Good day, everyone and panelists. We are the Group 2A. I am Henriette Jane De Leon, and together with my colleagues, Cesar de la Banda, Mariel de la Torre, Anika de Mata, and Sara Despues, are going to present our research study entitled The Level of Performance Among Medical Surgical Ward Nurses During the COVID-19 Pandemic.
The nursing care performance can be characterized as the ability displayed by the organizations or entities for the acquisition and sustained use of care delivery to effectively improve care for patients. Many factors affect the quality of nurse performance, and the common ones are their profile variables, which are sex, age, years of service, educational attainment, nurse-patient ratio. Age, working status, stressors like workload, pain, and death experience, conflictive relationship, and task ambiguity and hardy personality have been significant predictors of burnout. The goal is to provide data about the relationship between the nurse-patient ratio and overall performance of the nurse during the COVID-19 pandemic. For the objectives, the study aimed to determine the level of performance among medical surgical ward nurses during the COVID-19 pandemic. Specifically, it will answer the following research questions. First, what is the demographic profile of the medical surgical nurses when grouped according to the profile variables? Second, what is the level of nurse performance among medical surgical ward nurses during COVID-19 pandemic when they are grouped according to the demographic profiles? Third, is there a significant relationship between the level of nurse performance among medical surgical ward nurses during COVID-19 pandemic and the profile variables?
The study aims to benefit the following personnel, starting with the hospital administration, will be able to obtain key reference in monitoring and evaluating the performance of the nursing staff. Second would be the nurse services department will be able to establish an adequate workforce in the healthcare institution. Third would be nurses who have better understanding and perception of their profession. And lastly, the future researchers will be able to use our data in validating their research as well as use for key reference. The study leans towards the use of Rachel Meyer and Linda O'Brien Palace nursing services delivery theory, which derives the use of an input, a throughput, and an output in that theory. And in our study, the input is identified as the profile variables of the nurse, and together with the throughput, which is the level of nurse performance, the two factors will be correlated with one another in order to identify the output, which is the level of nursing performance among medical surgical ward nurses.
For the hypothesis, there was no significant relationship between the level of nurse performance among medical surgical ward nurses during the COVID-19 pandemic and the profile variable sex, age, years of service, educational attainment, and nurse-patient ratio. For the methodology, the study was a descriptive correlational research that aimed to describe the variables and the relationship occurring between and among those variables. The researchers used a purposive sampling in gathering the sample size for the study and have gathered a total of 48 participants that were nurses from Hospital A, B, and C, assigned in the medical surgical area. In terms of the research design, the researchers considered the six-dimension scale of nurse performance by Patricia Shurian as a reference to construct a set of criteria in the survey questionnaire, called the level of nurse performance. In data gathering of the study, it employed the use of an online survey via Google Forms application to conduct the study. With this, a Likert scale was used to identify the relationship between the nurse performance and the demographic factors. Goodenskate's validity test was also applied to ensure the effectiveness of the survey, and Cronbach's alpha test was also used, which the mock survey resulted in a score of 0.93 and has interpreted as highly reliable. Privacy of personal data assured the participants and the researchers of strict confidentiality, justice, and benevolence. The researchers also applied descriptive statistics and inferential statistics for analyzing the data and answering the statement numbers 1 and 2. And the researchers also utilized the chi-square test of independence pertaining to the statement of the problem number 3, which calculated the degree and the number of variables in association between the predicted outcomes and the real results.
The results of the study are as followed according to the statements of the problem that was mentioned and with the use of frequency distribution and chi-square test of independence. The researchers were able to gather a total of 48 medical surgical ward nurses. In the demographic profile, 12.5% or a frequency of 6 of the respondents was comprised of male registered nurses and 87.5% or a frequency of 42 are females. It is also observed that the majority of the participants with 79.2% or a frequency of 38 were each handling 5 to 8 patients per shift. For age, 44 nurses were young adults. And in terms of years of service, a frequency of 20 had 5 years and above of experience. And lastly, for high educational attainment, most of them achieved bachelor's degree in nursing. In assessing the level of performance, most participants grouped into the different profile variables answered always in the survey with a mean percentage of 81.29%, which carried out the following performances in the entire time during a shift. In addition, as observed in their individual responses in the survey, a few nurses have answered rarely to sometimes in the categories planning and evaluation and professional and ethics skills. As seen on the table of chi-square according to the degrees of freedom, the critical value was less than 0.05%. All p-values of each demographic profile were greater than 0.05. Therefore, there were no significant relationship between their demographic profiles and their level of performance.
For the conclusion, majority of the participants under different categories have answered always in different sets of skills and capabilities stated in the survey, and with only a small scale percentage of the population responded usually. Profile variables with p-values ranging from 0.101 to 0.7361 show that profile variables are not significant to determine the overall performance of nurses. These are the following recommendations that may help significant persons related to the study. The hospital administration may implement training services programs and obtain feedback and updates from the different areas of the nursing department. Nursing service department may promote planning and evaluation skills of the nurses in collaboration with the hospital administration and nursing staffs. Nurses may create an effective plan for delivery of care, ensure efficient patient care, and improve the safety and quality of care. Future researchers may incorporate a broader scope of the study from various hospitals, including public and private sectors, and a larger population for conducting the study. Explore different possible variables that could affect the nursing process and the performance of the nurse. Lastly, nursing students may enhance the knowledge and performance skills by increasing clinical exposures in different areas and providing different case scenario simulations. For the utilization of the study, this study will be submitted to the College of Nursing upon completion to serve as a partial fulfillment of the requirements for NCM 115 relayed to the research department of the Associated Hospital and made available to serve as basis for future researches pertaining to nurses' level of performance, nurse-patient ratio, and nurses' COVID-19 scenario.
These are our references, and we would like to acknowledge and thank the Lord God Almighty, and for our advisors, Doc Sheila Trajera and Doc Gosheng Fiao, and also Sir O.J. Jimenez for guiding us and looking out for us in our research study. May you have a good day. Thank you and God bless.